This segment of Delmarva Life is brought to you by TidalHealth.
Your child spikes a fever or falls off the monkey bars and complains of a throbbing elbow.
You have the worst headache of your life, or you cut yourself while peeling potatoes. All valid medical concerns that warrant one question.
Is this a trip to immediate care or the emergency room? Well, here to help answer that is nurse practitioner Tanya Matthews with TidalHealth Immediate Care Family Nurse Practitioner. Thank you so much for being here this afternoon.
Yes, thank you.
So tell me about what types of patient and medical conditions you commonly treat in the immediate care setting.
So we see a variety of patients on a daily basis, and of course this time of the year we're getting a lot of upper respiratory tract infections such as your common cold, ear infections, eye infections. With that being said, we're also going into what we consider our flu season. So we are able to do our COVID, flu, RSV testing on site. We're also available for minor illnesses and injuries such as sprains and strains, things of that nature.
When should we just go to the emergency room instead of the immediate care?
So anything that's cardiac in nature, anything that you question that could possibly be related to your heart should definitely be warranted an emergency room visit, especially those who have any history of cardiac illnesses or injuries. Also, we have patients who sudden onset of shortness of breath, difficulty breathing. This is something that's definitely new for you. You should go to the emergency room to have a full workup.
So say somebody does come in and they are worse off than they thought they were. How do you handle these critical situations?
So we do our full assessment on the patients. If things begin to change and or we have some significant findings that warrant further evaluation, we would go ahead, activate the EMS system, get them transported to the emergency room as soon as possible.
So what is it that makes TidalHealth so convenient?
It's easy. So if you're working all day, you have a sore throat, you could easily come into the immediate care. We can test them for strep, those type of things, do an assessment, and we provide information to their primary care providers as well.
And you have several locations, correct?
We do. We have 2 locations currently. So we are located, I believe it's called Sussex Highway in Laurel, Delaware. It's on the northbound side of the highway on the right side. And then we're also located in Seaford at Mears Building.
So I think I'm probably saying the same thing that you just said, but I'm going to ask it just in case. I don't need an appointment.
Absolutely not. Absolutely not. You just walk in. Now, there's a little bit of confusion because for those patients who have an option for what's considered My Chart online, you can go on and register, and that does not lock in an appointment. It gives you an estimated time frame of approximately when you could be seen.
Okay.
That's convenient.
It is.
Yeah. Tanya Matthews, family nurse practitioner with TidalHealth Immediate Care. Thank you so much for coming in today.
You're more than welcome.